Hi, my name is Paul Secord. I'm the Vice President of Philanthropy for the Mental Health Association of Central Florida. And we're excited because today is World Mental Health Day, and we are celebrating it by talking to different representatives from different demographics, groups, and communities, and kind of try to take a deeper dive into what mental health means for different groups. With me today is Miss Yasmin Flasterstein. Yasmin, thank you for joining us. You are the co-founder of the Peer Support Space. Is that correct?
That is correct. Thank you so much for having me, Paul. Looking forward to our conversation.
Well, this is great. We're going to dive into some questions about mental health in the LGBT community. Before we do that, let's talk a little bit about your background and how you got involved in mental health.
My passion for mental health is a mixture of personal and professional experience. Personally, having a hard time accessing mental health resources. And then professionally, working in the response to the Pulse tragedy here in Orlando,
Mm,
and really seeing gaps in our mental health system that were pre-existent beforehand, but it created a passion for mental health resources, specifically for communities that keep falling through the cracks of our mental health system. On a personal level, I don't speak for all LGBTQ plus people. I am bisexual. I'm also a person living with CPTSD, dissociative disorder, and depression. So those are some of the lived experiences that I'm bringing in. With that said, everybody experiences things uniquely. So I'll be doing my best to bring in the perspectives of what I've heard other people experience. And hopefully there's some things that resonate with some folks, and people could kind of take what resonates and leave what doesn't.
all right. Well, one of the predecessors to kind of endangering, mental wellness or mental health sometimes is stressors. And I think it's important that we kind of peel back the layers and see what different stressors people are experiencing in different groups. When you look at the LGBT community, what are some of the main stressors you think that people face that are really kind of putting their mental health, their mental wellness at risk?
Yeah, we live in a world that unfortunately isn't free of homophobia or transphobia. So a lot of times people have to live with microaggressions every day. And a lot of times a microaggression can be like a mosquito bite, but when you get 100 mosquito bites every day, it kind of becomes a lot, right? So it's
Yeah.
this feeling of being otherized or different from other people. A lot of times people are facing rejection from their loved ones, having a hard time fitting in, feeling alone in what they're going through. And we also live in a world right now where, in a lot of ways, our identities are politicized.
Mm.
Uh, and so it becomes really difficult to find healthcare, to find resources for yourself. And unfortunately, it's gotten to the point where a lot of people are fleeing Florida and, getting out because it's not an affirming space that it used to be. So, and on top of that, we're people, right? So,
Yeah.
we still experience life struggles. We still have loved ones that pass away. We still, experience all the things that everybody else does, but it's kind of these extra layers of living in a world that isn't always the most accepting of us, can definitely add extra stress.
And when you look at it, you mentioned some interesting things like the 100 or the 1,000 mosquito bites in a day, the microaggressions, and then you also mentioned, some rejection by family members. When you look at that, where do you think it's headed? Or is it which is moving faster towards a better space or a better place? Is it we're getting more family members now to be more accepting, or as a community, as a public, we're being more accepting? Which do you think is making greater progress now?
Yeah, I mean, I think it's unique to each individual. I think for a lot of people in the LGBTQ plus community, there's kind of this push for a chosen family, right? So this isn't necessarily my biological family,
Mm,
but I think that when times get hard, it brings out sometimes the worst, but also the best in people. So I think in a lot of ways, LGBTQ plus folks are finding community, whether it be online or an increase in LGBTQ plus organizations or spaces that strive to be safe. So I think that, we're kind of finding our own way to build that support for one another.
That's interesting. So stronger bonds, but just maybe in different ways.
Yeah.
Okay. Now, I know one of the challenges we have in mental health is stigma, right? There's still a lot of stigma about stepping forward and saying that, hey, you think you might be struggling with your mental wellness or your mental health, or you just want to see, explore the possibilities of how you might be able to get help. And in some areas it's frowned upon, or people feel like they're going to be less if they do that. Do you feel that the stigma in the LGBT community is greater or less, the same? What are we looking at just in general, do you feel, when it comes to LGBTQ community and the stigma with mental health?
Yeah, I think with the LGBTQ plus community, we face the usual stigma that all communities do. But on top of that, sometimes there's a pressure to, be fabulous or to be funny or to, kind of be cool. A lot of times LGBTQ plus community can gather at LGBTQ plus bars or spaces where a lot of alcohol
Mm.
might be involved. So I think that could kind of add layers to stigma of how we kind of navigate our emotions. But yeah, I think there's wonderful um people in the LGBTQ plus community that it's kind of this common ground of I don't know exactly what you've been through, but it's likely as another LGBTQ plus person that you've experienced certain levels of trauma and certain levels of feeling alone. So in some ways, I think that we're able to have really deep conversations, but it kind of takes a few peeling layers back to get there. It's not necessarily you just meet someone and now we're going to have a real deep conversation.
You mentioned that there's sometimes a pressure to be always up or entertaining or kind of life of the party, or very positive. Do you think that that's a coping mechanism in a way uh, for things, or where do you think that emanates from?
Yeah, I mean, speaking for myself, sometimes, I say I laugh so I don't cry.
Mm.
When you have so much going on, I think that a sense of humor could be a coping mechanism for a lot of folks where, it's a lot more approachable and accepted by society to be funny and to kind of make fun of ourselves or make fun of our situations. So I think that because of that, a lot of people have the best sense of humors in the LGBTQ plus community. But a lot of times that does stem from a place of hurt and from a place of having experienced, really tough things.
All right. And what do you think are some steps people can take, or we can take as just a big community of trying to get past that stigma and trying to get people to feel like it's okay to get help, it's okay to identify as how they want to identify, and then if they need assistance through that because of what they're experiencing, it's all right for them to seek out mental health help.
Yeah, I mean, I think that resource connection is great. And I think that, if we create a world and a society that is better for LGBTQ plus people to live in, that's also going to positively improve our mental health, right? A lot of times we kind of say self-care at folks, and unintentionally that could kind of put the blame on the individual. Like, why don't you
It's
just do
interesting.
this? Or if you just did XYZ, right? Versus
Yeah.
this of kind of communal care of, let's wrap ourselves around individuals, let's, create a world that is better for our mental health, right? So I think people taking the steps to really listen when LGBTQ plus people are sharing their experiences, but also not expecting them to educate and doing some research for ourselves to learn about pronouns, to learn about different labels, to learn about things that the LGBTQ plus community wish you knew. Something I often say is you don't need to understand something in order to respect it, right? So
That's a good point.
yeah, there's a lot of language in the LGBTQ plus community. We kind of call it the LGBTQ plus soup sometimes, the alphabet soup. And I know it could be a lot to learn all of it, but at the end of the day, it's okay if you don't understand something. It means a lot if you try to understand, right? If you say
Yeah.
sorry wherein you mess up someone's pronouns and you correct yourself and commit to doing better, maybe practice with your dog at home or something. But I think people, trying to understand, but even where they don't understand, just being affirming and letting people be. At the end of the day, like that could decrease someone's chances of feeling suicidal or feeling alone. So, like, what's it matter to you that that's how someone identifies and that you don't understand their pronouns or their, dating style or whatever it might be, just okay and move along. And it sounds simple, but I think it's a really big way that we could show up for folks. Or if you hear people making jokes at the expense of someone's identity,
That's a good point.
yeah, and saying, hey, I don't think that's funny. Can we use this word instead, or whatever it might be? But really being a aspiring ally, right? I'm constantly working towards finding more ways. It's a verb to find ways to support this community, and that could show up in a lot of different ways.
Yeah, it's interesting you talk about being an ally. One of the things I've heard is that when major tragedies occur, let's say like Pulse or something like that, or there's a racially motivated crime or something, I've heard people from that group say, you know what, I'm really disappointed. No one reached out to me to say, are you doing okay? How are you feeling about this? Even if they weren't directly involved, knowing that they're thinking about it. What are your thoughts on that? Because I know some people feel that if they take that step forward and do that, then they're kind of like reducing that person to one identity, and maybe in a way they're fearful of that, but at the same token they don't want to not acknowledge it. So how does somebody, I guess, navigate that when we want to reach out as an ally and say, hey, are you okay? What are your thoughts about that?
Yeah, I guess sitting with the intention of why you're reaching out to someone, right? Is it to make yourself feel better, or is it for the other individual, right? I think sometimes from a very human place of wanting to be a good person, right? We might reach out and want a community to comfort us that, like, you are good and you are an ally, right? But that's
It's
actually,
saying,
yeah, it's taking more energy for me to comfort you now that you feel bad that
interesting. Yeah.
you something. But I think it's a-okay to say, like, hey, I saw something happen that impacted your community and I wanted you to know that I'm thinking of you. Or, I wanted you to know that I care about you. Or I was wondering if I could send you some lunch or
Yeah, yeah.
kind of like a tangible thing. But I don't think that because of fear, we need to just kind of stay within our own boxes and not, connect with other communities.
Okay. Well, I know this could conversation go on for hours, right? Because it's a very deep conversation in a way. But we just touched on a few things. Are there any things you feel like we missed that would be important to cover when it comes to mental health in the LGBT community?
Yeah, I think something that is important when talking about the LGBTQ plus community or any community is intersectionality, right? So I am an LGBTQ plus person, but I'm also a Jewish person. I'm also a young person. I'm also an immigrant. I'm also someone who's experienced trauma. So really understanding that the way we show up in this world is through multiple lenses, right? So we might have resources for the general LGBTQ plus community, but really peeling back those layers of, what if you are Black and LGBTQ plus? What if you are an immigrant and LGBTQ plus? In what ways are we supporting different aspects of people's identities? Because the more kind of intersectional identities that you have that historically fall through the cracks of the mental health system, the harder it can be to find resources or to find support. So I think that's, an important part of the conversation and just talking to communities as a whole. And just, letting the LGBTQ plus community know that, like, if I don't know you, I still care about you and I love you. And I hope you have a good day, a minimally neutral day today. Yeah.
Absolutely. Yeah, I think that's a great point about the intersectionality, right? Is how you say it. Because we talk about this, there's obviously like hey, the Hispanic community has a very definitive view to a certain degree on mental health, and then and it's on the LGBT community too, and then you blend that together, and now somebody in that group who's Hispanic and LGBTQ has now like very unique, it's niched down to very unique circumstances to face. So do you see that in the mental health industry, the ability to have as much diversity in mental health professionals as possible might help people receiving services, then if they can identify with that exact kind of person going through their same exact demographic experience?
Yeah, there's certain things that, you just can't learn in school. I think that it's really important for providers to, educate themselves, to take courses that might help them work towards cultural humility, but you're never going to be culturally competent in something that you've just never walked, right?
True.
So I think it's kind of a harm reduction to where we all have a collective responsibility to educate ourselves on different ways that communities want to be supported, making sure we're learning from those communities themselves. But then, one reason I'm really passionate about peer support is at the end of the day, there is a lack of diversity in mental health providers for the level of need that there is in communities. And no one's going to understand the cultural nuances of a community like a community itself. So, what we saw, after Pulse, what we've seen after other, large hate crimes that targeted communities or just world events that targeted specific communities is they turn to one another.
Mm,
And part of that, I think, is, a lack of access to providers that are going to, be a soft landing space for your intersecting identities. But part of that too is for these communities, a lot have had negative experiences in the mental health system, and they have a history of distrust for really valid reasons, right?
yeah.
Uh, so I think a lot of times, especially with layers of stigma, could be more approachable to connect with others that have similar lived experience as you. It kind of feels like I'm just making friends with other people that, I have something in common in. And so, for those reasons, I think peer support is really important, specifically identity focused peer support, so that folks can have somewhere where they're not trying to be fixed and somebody can just say that really sucks and you feel seen in that, right?
Yeah.
So, yeah, I think peer support is really, really a valuable resource when it comes to identity focused mental health care.
Okay. And that's a great segue to kind of wrapping up. So I see the sign in the background, Peer Support Space. I know you're the co-founder of Peer Support Space. Just briefly, what does Peer Support Space do, and who does it serve?
Yeah, so peer support space is a community of people with lived experience navigating various mental health and life struggles. This includes things like grief or trauma that aren't necessarily mental illnesses, but are just, hard to live with. So we're a space where, people can have a support system with whatever they're going through. They don't have to navigate it alone. We provide 75 community gatherings per month.
Wow.
Those are peer-led support groups, both virtual and in person, general, identity focused, as well as activity focused. So spaces where all anxiety and experience levels could explore different hobbies and connect with other people that have shared ones. We do lived experience led advocacy workshops like What the LGBTQ plus community wish you knew. And recently we opened a peer respite, which is a space people could stay for free for up to a week and get away from their home environment and be
Wow.
the driver of what day to day looks like. They could stay to themselves, they could do activities with the peer supporters that are on staff 24/7. So the hope is that, we're really filling gaps from multiple angles. You don't just have somewhere to go for a few days. Now you're leaving with a support system. If you heal through helping or advocacy, you can get involved with our advocacy. So just really looking at different ways that our mental health system can drop the ball sometimes and catching people there so they ongoingly have support. Our goal isn't to discharge folks and that they don't need us anymore. We're here if and when people want or need it.
All right. And what's the website if someone wants to go and learn more about Peer Support Space?
Yeah, thank you so much for asking that. It's peersupportspace.org, and then there's a big download or resource button on the homepage that has all of our groups. And then we also have tinyurl.com/respite stay is the interest form to stay at our respite. And all of our resources are free and for those that are 18 and up.
Okay. Well, this has been great. I know this is such a big topic. I think we covered a lot in just this short period of time. I really want to thank you for helping to celebrate World Mental Health Day with us, Yasmin. It's been great to talk to you.
Thank you, Paul. Happy World Mental Health Day. I appreciate the conversation.
All right, thank you. Well, everyone, we have more videos like this on our website. So you want to visit mhacf.org and celebrate World Mental Health Day with us. Thank you.